Have you ever heard of a silent disease that grows inside the male body like a shadow, imperceptible, relentless, and often fatal? It doesn't cause pain. It doesn't cause fever. It gives no clear sign. And when it's finally discovered, it may already be too late. We're talking about prostate cancer, an enemy that acts in the dark without drawing attention, but that today is among the leading causes of death among men. The question is, how can something so small cause so much damage? Before we continue, like the video, subscribe to the channel, and share it with someone you love. Most only discover this problem when it's already too late. And if you know someone who has gone through this, comment here. Your story can help other people. The most alarming thing is that, in the early stages, prostate cancer almost never presents visible symptoms. It advances silently, like an internal crack in a dam. And when the first signs appear, the tumor may already be pressing organs, blocking urinary tracts, or worse, spreading to the bones. But why does this happen? And more importantly, what can you do to avoid this fate? Let's start with a fact that needs to be taken seriously. According to the World Health Organization, 1 in 6 men will be diagnosed with prostate cancer at some point in life. The statistic does not choose race, profession, or social class. But there's something the numbers don't show. Many of the most serious cases could have been avoided with a simple exam, or by paying attention to seemingly harmless signs. The prostate is a gland that few men know exactly where it is, or what it's for. But it has a vital function, to produce the fluid that protects and transports sperm. It sits just below the bladder, surrounding the urethra like a ring. Now, imagine this ring becoming increasingly rigid, tight, and inflamed. What happens to the flow of urine? That's right. It weakens. It fails. And this is just the first warning sign. Many men report that it all started subtly. A slight discomfort when urinating. Then the stream became weaker. Then the need to get up at night, 1, 2, 3 times. Until one day they notice something much worse, blood in the urine. Or in the semen. And then the alarm sounds, but it may already be late. The question is, why do we ignore these signs for so long? The answer lies in fear, in stigma, in lack of information. That's why this video is not just a warning. It's a call to action. Today, you will learn the 7 most dangerous signs of prostate cancer, how to identify them early, and what to do immediately if any of them appear. And most importantly, how to reduce your risks, even if you have a family history or are already over 50 years old. But first, we need to talk about something that rarely appears in health videos, the emotional impact. Many men with prostate symptoms don't tell this to anyone. Not to friends. Not to their partner. They feel ashamed. They think it's an age thing. But the body doesn't lie. And when it starts repeating signals every night, it's calling for help. And here comes the most surprising fact. Recent studies from the National Cancer Institute show that, when detected early, prostate cancer has more than a 90% chance of cure. 90%. This means that, in many cases, a rectal exam or a blood test, PSA, would be enough to detect the problem years in advance. But how many men take this exam? And more, how many understand what PSA is? PSA stands for prostate-specific antigen, a protein produced by the prostate. When its levels increase in the blood, it may be a sign of inflammation, infection, or cancer. But attention, high levels don't always mean a tumor. And low levels don't always guarantee safety. That's why medical monitoring is indispensable. Returning to the symptoms, and now we want your full attention. One of the most ignored signs is that feeling that the bladder never completely empties. You go to the bathroom, urinate, but leave with the impression that something is still left. This happens because the tumor starts pressing the urethra, or the nerves that control the bladder. Another common but worrying symptom is pain when urinating. It may seem like a simple urinary infection, but if the discomfort persists, especially if accompanied by blood, it should be investigated urgently. And there's more, pain in the lower back, hips, or thighs. When prostate cancer spreads, the bones are usually the first to be affected. So, if you feel deep and constant pain in these regions that doesn't improve with painkillers and isn't related to physical effort, pay attention. It may be much more than a muscle pain. And what about sudden weight loss, without diet or exercise? Or constant fatigue, even after a good night's sleep? These are signs that something in your metabolism is out of control. And often cancer is the cause of this silent imbalance. But after all, how does all this start? What are the real triggers of this type of tumor? In addition to age and genetics, there are lesser-known but equally dangerous factors. Men with diets rich in saturated fat, processed meats, fried foods, industrialized products, have a higher risk of developing prostate cancer. Those who consume tomatoes, green vegetables, seeds, and omega-3 have a lower risk. Coincidence? No. Lycopene, present in tomatoes, is a powerful antioxidant that directly protects prostate cells. Another alarming factor is exposure to chemical products. Farmers, factory workers, and even hairdressers who frequently handle dyes or industrial products show a higher incidence of the disease. Behind this are the so-called endocrine disruptors, substances that unbalance male hormones. Sedentary lifestyle is another invisible enemy. Men who don't exercise regularly are more likely to develop chronic inflammations, gain weight, and weaken the immune system. All this favors uncontrolled cell mutations. On the other hand, just 30 minutes of walking a day already activates anti-inflammatory processes in the body. And alcohol and cigarettes? They are two of the biggest saboteurs of prostate health. Tobacco releases carcinogenic substances that alter cell DNA. Excessive alcohol causes inflammations throughout the body, including the prostate. Therefore, reducing or eliminating these habits is more than advisable. It's a matter of survival. But perhaps the most important of all is to understand that you have control over most of these factors. Nutrition, exercise, sleep, preventive exams, all this is within your reach. We're not talking about miracle promises. We're talking about science, about real prevention. And here's a direct piece of advice from someone who has studied this subject deeply to alert you. If you're over 50 years old or over 40 with a family history, schedule an appointment with a urologist this week. Don't wait. Don't postpone. Don't ignore. This simple gesture can make the difference between living with quality or facing years of painful treatment. And if you've made it this far, share this video with someone important to you. A father, a brother, a friend, a coworker. This information can literally save lives.